Hello my friends, welcome to science class as a student of science. Hello my friends, welcome to medical science class as a student of medical science. I want to prepare every branch of medical science. What kind of things I do, that is bad, that is knowledge, that is yes, and that is good, or that is an art. As you must know, the one and only creator except for all location last time this special job. Now my friends support us medical science class. Discover the about my science. We already described how much question? Like one. Ya alif lam lam yellow shapi yellow mapi law kapi anar abdul mamushir shapi anar abdul mamushir napi anar abdul mamushir shapi. Now my friend is about a medical science class. We describe elaborated about medical science. In case of organ transplantation, if rectal cancer or rectum disease, anything occur, how this is the simple. If sphincter remain, cut the rectum and connect to the sphincter, gut other part. And if rectum sphincter not remain, then connect the gut to the anal canal and make a artificial sphincter, just like that. Nothing else in case of rectum. Already with organ transplant, how can we survive organ transplant in brain, heart, lung, liver, kidney? We already described pancreas. And smell is not important, but spleen transplant also possible easily. Nothing. Fine. And liver and stomach, gut. What did he say? And we already said microsurgery and nanosurgery. In case of micro instrument introduced to vein or artery and go to the thoracic cavity and heart, lung and abdomen. Also in pelvic region. Also in case of by vein heart, go to the brain and surgery. By vein and heart, go to the brain surgery. Microsurgery or nanosurgery. Micro instrument introduced that. In case of what is the simple policy of microsurgery? In case of microsurgery, if needle in institute, ultrasound guided needle. For example, brain. If any tumor occur, you go to the vein or artery, go to the brain. Hot vein, you enter the brain with hot artery. Fine. By vein and artery, you go to the brain. Fine. Hot vein in the return. Internal carotid artery, jugular vein. By that policy, you went to do the brain. By introducing the brain, what is the tumor cell? You can injure the tumor cell. And by that tumor cell, and suck out that cellular material. And for healing, for reduction, reduce the bleeding, you can utilize surgical fluid. Fine. Brain is tough. If brain possible, then any organ can be possible. That is the reason I say that. Fine. Now that is microsurgery or micro instrument surgery or nanosurgery. Nano is still now tough, but micro can still now researchable, but microsurgery. Micro instrument surgery, microsurgery. And said is micrometer, microcell surgery, ultrasound guided. Hopefully inshallah as soon as possible. Ultrasound guided. And next my friends about today we discovered about heart disease. The next previous class we discovered about heart disease. And in case of what about lung disease? In case of lung disease, you have a productive cough coffee symptom, and you have a coffee symptoms, coffee productive coffee breathlessness, and in case of breathlessness and in case of fever and chronic to fever, respiratory tract infection. In case of respiratory tract infection, if cough is not by antibiotic, it is not cured. That is, it is not bacteria, common bacterial infection. That is Mycobacterium tuberculosis infection. After 2 weeks, in between 2 weeks, antibiotic taken, cough, lung is not cured. That is Mycobacterial infection. If mycobacterial infection is not cured, that is misinterpretation. That is fungal infection. Fungus, aspergillosis or fungus. Thank you very much, my friend supporter. Today is enough from medical science class. I am the representative of Dr. Mohammad Shuzuddin. Today is enough from medical science class.